So, let me introduce myself. My name is Berenice. I am a student of the University of Cincinnati in the Radiation Science program. I'll be graduating December 15th. Woo. And this is one of my last projects where I have to talk about a topic that is close to me. So, there we go. Tonight, we're going to be talking about brain injury. Cups, please. You're going to, and the topic of my presentation is left versus right. What to expect after traumatic brain injury. So.
I drink your versus brain injury. Let's go.
So we have a very simple objective today. So I want you to understand what is a brain injury. There we go. We are going to review some basic anatomy and functions of the brain. We're going to describe some methods that we use to diagnose brain injury. And we're going to compare some of the treatment between brain injury, if it's short-term or long-term. And we're also going to talk about what happens after a brain injury and what kind of problems you're going to have. Sorry. I have a timer here that I forgot to click. Okay. We are going to try to follow the outline. So I'm going to give you some statistics, basic anatomy, functions, functioning of the brain. We're going to talk a little bit about CT and MRI, which are the most common forms of diagnosing a brain injury. And we're going to talk about also treatment, recovery, rehabilitation, and hopefully conclusion. That's it. All right. So, what is a brain injury? Pretty much anything that disrupt the functioning of the brain is considered a brain injury. So, anytime a person gets hurt and she cannot perform the same functions that she did before, that is considered traumatic brain injury. So, if you think about brain injury, if you take a guess, how many people do you think go to a hospital every year with a brain injury? Any guess?
Really? You need like nationwide?
Yeah, nationwide.
Million?
A million?
20%.
No, just give me a number. I don't do math, you know.
56.8 million.
Not that high. 2.5 million people every year suffers from a brain injury. Every year. That is it has been the average since 2009. And that is according with the CDC. Now, 2.5 million is the people that goes to a hospital and seek for help. They think the number is actually higher because there's a lot of people that don't go to the hospital, like people that are in pain and suffering and don't go to the hospital for days, and people that don't have insurance, and also people in the military, because they have their own clinics. That is not part of the number either. So if you take is about 2.5 million people a year with emergency room visits. There is about 280,000 people that actually gets hospitalized to be treated. So those are the ones that goes, don't go back home, stay in. And from that, there is about 56,000 people that die every year from brain injury. If you think about it, it's about 153 people a day. It's hard to believe that every day that much people are dying from something simple like falling, right? So that is my take there. So if we're going to divide, so 35% of people suffers from a brain injury. I hope you're still drinking. 35% is from fall, just tripping over, going through your living room and hitting the head on the wall. 17% comes from traffic accidents, car crash. 16% is being hit by something or hitting something. 12%, nobody knows. You just show up with a brain injury. I always say it must be the amnesia that kicks in, because how you would you not know? 10% comes from assault. So then you have another
It's actually high.
way to get a brain injury, football, very common. Even though they are not serious most of the time, the kid is fine, you know, I have a little concussion. But football, sports, military, big time brain injury with, well, all the IEDs and so forth, especially from, since they are from war in Afghanistan, Iraq. Lots of brain injury there. And just being in an older age, you are more likely to fall and suffer from brain injury. So, my amazing friend there is, we don't have it. So we know that the brain controls pretty much every function of your body. So from breathing to body movements to heart rate, the way you behave, everything is related to your brain. There's nothing that really cannot function without the brain functioning first. So if you have a brain injury, no matter how small it is, there will be some kind of consequences to your body. If I'm going to talk a little bit about the functioning. So you know that your brain is divided in two parts. First will be right and left. So it will be left hemisphere, right hemisphere. And on those sides, it's going to be divided also in lobes. So if we talk about the frontal lobe, that is the light pink, right there. That is the part of the body that controls movement, problem solving, concentration, thinking, behavior. All your filters are in the frontal lobe. So a person, when they have a brain injury and get damage to the frontal lobe, they become a little different. Like a common thing, cursing, extreme cursing, and they don't even know they are doing. But because they don't have no longer those filters in. You know, when you talk to your boss, you don't talk the same way you talk to a friend, right? Well, that is gone. And so that is a big thing during traumatic brain injury, especially within the frontal lobe. All of a sudden, that person becomes a little bit, or a lot different what she used to be. We can talk about temporal lobe, that is actually the greenish area. That is associated with hearing, language, also memory. If we talk about occipital lobe, that's right here, the yellow, and that is associated with vision or perception. If you have any damage to this area, you're going to have what they call visual distortion. Let's see, you look to the floor, and instead of just seeing the floor, you're going to see waves like the floor is warped. And that is because there is pressure on the back of the brain, and it disturbs your vision. If we talk about, let me see what else here. The back here, the cerebellum, is actually has to do with postures and balance. So if you would have a damage to that area, you're not going to walk straight. Actually, you're probably not even going to walk, depending how severe it is. That gives you the sense of you become very dizzy. And let's say if you want to walk in a straight line, you are not going to walk in a straight line just because you no longer have that balance in it.
Okay.
So, because everybody's so different, and even though, you know, we all have,
Papa.
I would say we all have brains, but no injury are alike. So a person can say, oh, I have a traumatic brain injury and it was on the left side, and somebody says, oh, I did too. It doesn't matter. No two injuries are alike because no individuals are alike. And depending how old that person is when they got the injury, or how they got injured, that will make a big difference on the outcome too. So This is a CAT scan. Like I said, CAT scans are used a lot in brain injury just because, well, one is super available. Any emergency room has a CAT scan. Super fast. You can get a scan and results in a matter of minutes. And if you think about your head, right? That is the outline of the person right here. So the CAT scan, like in baggage, slice the bags, those people that work in bags, and you're looking from the top down. So imagine, take the top of my head and now look from up down, and this is what you see. Right here, eyeballs, actually your nose, right there, and then parts of the brain. Now I'm going to point out, you see this little line here? This is what divides your left and right side. This is supposed to be always there. And you're going to understand in the next slide. Those here look like an angry face, but it's not. It's actually ventricles in your brain, and that helps with the cerebral fluid to circulate. And it's black because fluid and air always show black in a CAT scan. And you can see how it's symmetrical, kind of, most of the time. And this is what it's supposed to look like. Now, if you have a brain injury, this is what they call actually a simple one. This here is a bleed. They're not supposed to be there. So because you have this blood right here, it pressures the blood, the brain, and you see how now you don't have a midline anymore, and everything gets squeezed. And that's what is causing the injury. Now, this is called epidural hematoma. If you think about the brain, you have your skull, and right above the brain, there is a lining. It's called a membrane, or called the dura. When you have a bleed between the skull and the dura, it pushes the brain, but does not bleed actually into the brain. This is less severe than what they call a subdural. Subdural means you're bleeding actually in the brain. And what it happens here, even though it's on the right side, see, right there. So you think, oh, the damage is right here. Well, because there's so much pressure now and it's pushing everything, now you're getting what they call a diffuse injury. Because now the left side is getting affected. So that means more injury to the brain, and that means more consequences from that. This is another one. This is also a CAT scan. This here is a bullet fragment right here. It shows really bright. And this is how the bullet went through right there. I don't know what happened to the person, but I did enjoy the CAT scan. Okay. And those are the things that if you put in a summary what happens to you when you have a brain injury. So you have energy and quick thinking, and you have good memory, and you're calm, not always. Motivation, good concentration. And after a brain injury, more likely, you're going to be tired all the time. You're going to have very what is called slow processing. That is me. Dizziness, poor concentration, weak memory. And that is like, this can last from a couple days, because it was just a minor injury, or it can last for the rest of your life. It all depends how severe the injury was. So, then you talk about, so let's say you did bang your head, and now you feel like you're feeling sick. So you decide to go to the hospital, maybe I should check it out. Well, pretty much 80% of people that goes to the hospital, to the emergency room, goes back home. They say, oh yes, you have maybe a minor concussion, you're okay. In 3 days, follow up with your doctor, and everything should be fine. And it's great, right? You check it out, and maybe a week later, you feel okay again, and things go back to normal. Other people are not so lucky. So you go to the emergency room, and now they say, well, something's really wrong. So now they have to figure out what to do. Are you going to get a CAT scan? Probably. What kind of injury you have, how severe it is. And for a lot of people, it is a fight against time, because you need to stabilize the person. Because what happens anytime you have a brain injury is one of the biggest problems is the brain swelling. Because now you not only have the first impact, but now you have a second injury because of the first. So your brain swelling, well, that is going to cause more damage too. Like I said, most of the time, 80% of the time, people go home and they're fine, and they say, if you feel sick, just come back. And sometimes people come back, and sometimes they don't. So like I said, CAT scan is super used, and you can see here some of the scans. There's a major bleed right here. This is what could diffuse. All this here should not be. This is all bleeding. This here, the midline is gone, and you can barely see the ventricles anymore. And so a doctor is looking at the scan, immediately he can say something is wrong. This guy is in bad shape. So is it need surgery? Does it need treatment? Does it need, whatever? The problem is, sometimes the CAT scan does not show any injury, but the person still have symptoms. They cannot remember what year it is. They don't remember who is the president. They don't know how to say their last name. So then is when they usually order MRI. MRI gives more detail of the brain itself, the mass. Brain is really soft tissue, so any pressure can cause damage. So usually the MRI comes, and things that are not seen in the CAT scan, but because the MRI concentrates more in the tissue itself, then we'll show, oh, there's actually a little bit of swelling here, there's a little bit of bleeding there. So then they can then they understand why that person's having the symptoms, even though the CAT scan didn't show right away. Alright. So let's say the person now is diagnosed with a severe brain injury. Well, the first thing they're going to do, they're going to try to stabilize them. Like I said, if it requires surgery, if it requires sometimes just drugs or any kind of medication, everything is to make sure that the person's not getting worse. Like I said, if the brain swells now, they will not be able to breathe on their own. So they have to stay in and be treated. And the treatment, can be like this. This is actually really nice. And sometimes it's just keeping track of the person, how they're breathing, if they can even lift their head. It all depends, like I said, how that person got injured and how severe it is. Like I said, the main goal of the being hospitalized is to minimize the consequences of the brain injury and not letting it get worse. Once the person gets stable, immediately they will start some kind of rehabilitation testing to see how much damage is there. And if that means that somebody will come in and will talk to you, will tell you a story, and then they're going to ask back, what did I tell you? And depending how much you remember, they're going to kind of evaluate, or is that damage for what part of the brain, and they're going to start with occupational therapy, physical therapy, psychotherapy. They have done so many studies that prove that the fastest you get treatment after brain injury, the better chance of recovery. So sometimes people in the hospital, they can barely move, and somebody's there talking to them, trying to say, can you squeeze my hand? Can you do this? Because all it is like what they call finding new pathways. So you hit your head, and now that part of the brain is damaged. Your brain can still function, but it's like you don't know the pathway to take. So you have to figure out new ways to do it. Let's say you cannot move your hands. So your brain will have to find new ways, pretty much, and relearn how to move your hands. Things that we take for granted that we do every day, you have to relearn. And again, every treatment is different because every person is different. So there's no two treatments that will be the same. This is a picture of a rehab. This is super common, the wheelchair or whatever not. But you have people that will come and sit and do occupational therapy fine motor skills, just holding objects, moving one thing to the side of the table and to the other side. Then you have physical therapy, where they're actually, let's say, trying to teach you how to walk again, because your brain pretty much forgot how to do it, so now you have to relearn. Here's another picture. And the therapy is not like only physical, they call what they call recreational therapy. And it's pretty much teaching you how to turn on the TV, how to listen to music, and this is, you see the nurse with the guitar. And it seems so drastic, but it is actually things that happen. They will do anything to motivate you to get better. And one of the bigger things with brain injury too is that the person go through all this transition, and sometimes you just give up. So they will do anything, and if that means singing to you or tapping dance, they will do it. They will do anything to get you moving. This is one of my favorite pictures. This guy had the biggest smile. You see the wheelchair behind him? After a brain injury, you put your whole life in perspective. So everything that we do every day and we take for granted, right? Now you have to relearn. You have to learn how to walk again, how to feed yourself, how to take a shower. So the little things make you feel so good. Like, I got up today, and people are like, ooh, yeah, that is a big thing when you cannot get up. When you're in a wheelchair, and you don't know if you're going to be bound to that wheelchair, or the day you stand up and take one step is a big thing. When most of you know that I had a brain injury 3 years back. One of my biggest happier day was when I was allowed to take a shower by myself. So I was in the hospital probably 2 months, and I couldn't. You cannot go to the bathroom without somebody there with you. And I would beg them, please, please let me. Nope. And the day that I was allowed to take a shower alone, I felt like I won the lottery. I couldn't be happier than I finally had some privacy, right? And those are the things that, like I said, we never think about it. You get up in the morning, you take a shower, and you go to work. You never think about it. Oh, it took me 2 hours to dress up today because you're only using, one hand or whatever not. So when I had my injury, I had my first, I fell. 30 days later, they found out that I had 3 bleeds in my brain. And so I had my first surgery, and it went well. So when I came out, my speech was a little bit off, but it's always off anyway. And everything seems fine. So it's going to take a little bit, but you'll go back to normal. Well, 4 weeks later, I had another bleed. And just think about it. If you break a bone and you start healing, and a month later you break the same spot again, it's a lot worse than the first time. And this is exactly what happened with the brain injury. So I have a second bleed that was even worse than the first one. So I ended up having to have surgery again. And during my second surgery, I also had a stroke during my second surgery. So when I woke up, I could not move half of my body. And talking about being scared, your whole life is completely changing right there. And so from there, I stayed in the hospital for probably 2 weeks, just because they couldn't figure out how to treat me. Eventually, when I was stabilized a little bit more, I had to go to Millard 1, and I stayed there for like 6 weeks. And again, I was in a wheelchair, couldn't move left of my arm. So that was when, somebody has to feed you, and take you to the bathroom. And it was a fight from the beginning to the end. I didn't want anybody touching me. I didn't want anybody helping me. And I couldn't do it either. So, and they told me there, because I couldn't move especially my left hand, they said it will be about 2 years before you can get some of the movements back. It will be 2 years before you can start feeling like you can do things in your own. And I never took no for an answer. And I said, I don't want to be 2 years. I don't want to be 2 years stuck, right? And I think God was very merciful. I'm a person of faith, and I believe God showed a lot of mercy, and I was able to recover a lot. But I also had amazing treatment. I had amazing doctors that were doing everything that they could to help me out. And I think I was a little stubborn too, to accept what they were saying, that it would be 2 years before I could walk by myself. So it was a long road, and it took me it took me 14 months to go back to work. And I was still not all together, believe me. I was faking a lot, fake it till you make it. I was faking a lot because I had no clue most of the time what I was doing. And the consequences of my brain injury is that now I have ADD. My memory is not good. Most of the time, I am a little lost or completely lost, depending on the day. Some days I wake up and I feel like $1,000,000, and sometimes I wake up and I cannot spell my name. So it all depends how tired I am, how stressed out I am. I became a crybaby, which I was never a crybaby before. So Charles was a witness when I was moving, and we were on the checkpoint, and she's like, "How are you doing, Berenice?" Immediately. Nobody could even look at me, and I was crying, but that is the way that my body now deals with stress. It just cannot help. But at the same time, it's like, look how much I have achieved in the last 3 years. I cannot complain. I cannot complain if I have to take some medicine for ADD, or, if I cannot remember all the tasks that I have to do. So, for us that work with public, the message that I have to you is like, be patient. Sometimes we have people that come and we're in a hurry trying to do things, and even though they look okay, they might not be. Most people would come to me and say, "Oh, you're fine, you look great." I think they're expecting some kind of metal plates or something like that, and there's none. Yeah, outside you're okay, but inside is a complete different story. And I wish people would understand that. It's like, and of course, if you ask, "Are you okay?" "Oh, absolutely." Of course not. But who wants to say no? Well, some people do. It's just the way we are. So if you have to take anything home from this presentation today, one, brain injury is super common. It happens a lot. It could happen to anybody. It happened to me. So, and value everything you have. There's so much, like I said, we take for granted every day. And everything can change one split second, and your whole life is going to be different. So, enjoy your life. That's it. It's a wrap. No, I have questions. Somebody has to have questions, please. Any questions? Besides, what's my name? Come on, people. You can ask.
Which parts of your brain did you injure, or what was most injured?
It was the right side and the front lobe, right side. And that's why the ADD kicks in. I was always it seems to me you always favor one side of the brain or another, so you're a very logical person or you're a very creative person. So now it seems to be that my right side doesn't work well, so everything has to make sense in order for me to understand. So when somebody says, "Yes, when do you see yourself in 10 years? And I'm like, "Oh, I can't see the big picture. It's too far and too many details for us to kind of focus and have a path. Everything has to be like breakdown in steps." So, yep. Yeah, Dave.
So how did you encounter your brain injury?
I wish I was like, I was skiing, and when I went down the slope, but nope, I was home, and I had worked a 12-hour shift before as a EMT, so I was super tired. Went home and I was laying down, and I heard the girls arguing, and I decided to go check it out. I got up, felt dizzy, and started sitting back. You feel dizzy, you sit back, breathe through it, and I'll just keep going. I tried to walk back. I pass out, hit the wall, and once again, I'm a stud finder. I hit a stud. pass out, and when I came back, I don't know how long I was out. The kids were around me and they were complete panic. And as a EMT, I was trying to diagnose myself. How long did I pass out? Did I have a seizure? And my daughter said that I had asked the same question about 6 times. So went to the hospital, you know, I had a huge bump in my head, and it wasn't as horrible. I had a little problem remembering things. I could not remember what year it was or the month, or so they kept me there for the night, and then they said, "Oh, follow up with your doctor in 3 days." And I did. Went back to the doctor, and everything was fine. She said, "Oh, your head is going to hurt," and it did for a whole month. I had horrible, horrible headaches, but I thought it was because of stress of moving and whatever not. And one day I got up and I couldn't stay up. Started getting really sick, throwing up a lot, horrible headaches. It was like my description was the worst pain in my life. And went to the doctor, and they were like, "Well, you know, maybe it's just a migraine." And we did that for 3 days, and then they finally did a CAT scan and found out that I had 3 major bleeds, and I had to have surgery right there.
That makes some soup.
That's it?
No, Berenice.
Oh,
So, in all, how long did it take them to finally diagnose that?
for me,
Yeah.
it took 3 days for them to finally realize something was wrong. And that because I told them I was going to die. Because I went to the hospital Monday, and I said, you know, sick and throwing up a lot, and I said, something's wrong. They're like, "No, you just have a migraine," which I never had it before. The second day, and every time I went, they gave me some kind of drugs, so I would go home and feel great, and that would wear off, and I would start all over. Second day I went in, and I told them something's really, really wrong. This is not getting better. Well, we're going to do an MRI, but then this is like a Tuesday, and they could not do it until Friday. So on Wednesday, I got up, and then this time I couldn't walk anymore. One, everything looks warped to me. I could not see anything straight. And I couldn't walk. I didn't have the balance, so they pretty much dragged me in. And when they're talking to the doctor, she's like, "Oh, I have to wait until Friday." And I told her, "I'm going to be dead by Friday. I'm going to die. I know I'm dying right now." So she's like, "Oh, let's do a CAT scan." And they did, and the hospital International Falls was so great. They did the CAT scan, and they sent me home. And yeah, they took like 5 hours to refine me. The doctors in the Duluth all panicking because they thought I was pretty much at the end of the line, because there was, remember the midline? My midline had shifted so much. You could not see, you know, the brain, you see like little shapes and you see curves. My brain was just like a sponge that was squeezed because there's so much blood in there. They could not understand how I was still talking. And I kept telling them, "I hit my head a month ago." And they could not even understand how I was still describing what I was feeling. So got to the hospital, and then because of all the drugs that they gave me and I falls, they couldn't do surgery. So I had to have a blood transfusion first because my blood wasn't coagulating. So they had to wait another 12 hours to do it. So, but like I said, I have a picture somewhere where I am thumbs up, you know, tubes coming out of my head, and I'm like, yes. And of course, that was the first time around. The second time around wasn't that happy, but and they told me that a person that falls and had like a bleed 30 days later, it only happens like 5% of the time. So I was way in the top. 38% of people that have the injury that I had die in 30 days, and I had twice. So I feel kind of special sometimes. It's like I beat the odds twice. And then sometimes I feel guilty because so many people don't make it. See what I mean? It's like, oh, why me? So I try to put that in perspective. I try to be a better person. I think the brain injury made me a better person because I was giving a second chance that a lot of people don't get. So I try to remind that every day about that. Is it? Yes? Tequila time.
time.